Hey everybody, welcome back to lecture number 2 on blood. So, last time we were talking about red blood cells, what they looked like, what their job was, a variety of different things. We're going to continue to talk about red blood cells, but first we got to zoom out a bit, and we're going to talk about a process known as hemopoiesis. Hemo means blood, poiesis means making. So, literally, it's like blood production, but it's referring to blood cell production. So hemopoiesis, it occurs in the red bone marrow. There is a precursor cell, a stem cell, called the hemocytoblast. Hemo again means blood, cyto means cell, and blast means maker or producer. Think back to AP1, like osteoblast, chondroblast, that sort of thing. So a hemocytoblast in the red bone marrow will undergo a variety of changes and turn into all of these different possible formed elements, blood cells, platelets, red blood cells, white blood cells, all different types. Okay. So hemopoiesis, production of red blood cells, of all blood cells, reds, whites, and platelets, occurs in the red bone marrow, and the beginning cell, the stem cell, is called the hemocytoblast. Now, go back to MP1 for a second. Where is red bone marrow located? It is in the axial skeleton. So that's the skull, the vertebrae, the ribs, the sternum. So that's our axial skeleton. Plus, red bone marrow is located in the girdles. So pelvic girdle, so we got the hip bones here, as well as the pectoral girdle, so we got the scapula and the clavicle. Also, red bone marrow is in the proximal epiphyses of the two humeruses, so the rounded close end of each humerus, as well as the proximal epiphysis of the femurs. So that's where we've got red bone marrow. And red bone marrow is the site of hemopoiesis. This is actually a microscopic view of red bone marrow. It is abundantly cellular. You can just see all the cells, all the nuclei, because we are making so many blood cells all the time. And of course, what blood cell do you think we're making the most of? Well, it's got to be the one that we have the most, the one that cannot reproduce itself, and that's the red blood cell. Now, the production of red blood cells is known as erythropoiesis, so red synthesis, red production, literally. So here is a stem cell, the hemocytoblast. Here's another stem cell, hemocytoblast. And here we have the stem cell, the hemocytoblast, becoming a red blood cell. In other places, it might become a white blood cell or even become platelets. As it goes down the red blood cell pathway, look how the nucleus gets ejected. Because we know our final red blood cell has no nucleus. Notice how we also are going to acquire that characteristic biconcave shape. All right, let's see if we can advance the slide here. Now, the process of erythropoiesis is stimulated by a hormone from the kidney called erythropoietin. Okay? If any of these situations occur, if somebody is hypoxic, not enough oxygen, anemic, not enough red blood cells, if they've got gas exchange problem in their lungs or their tissues are just demanding oxygen. So if these situations happen, the kidney is going to make this hormone called erythropoietin. Erythropoietin travels in the blood to the red bone marrow and stimulates erythropoiesis. Once that happens, we'll have more red blood cells, and erythropoietin levels will come back down. Some good old-fashioned negative feedback here. So what we want to remember is erythropoiesis is stimulated by erythropoietin, which is made by the kidneys, and you're going to especially make more of it when you either don't have enough oxygen for whatever reason, or you need more oxygen for whatever reason. All right, good. Let's keep talking about this a bit. Let's suppose you decided to climb this mountain and hang out up there. There's you. You're very not drawn to scale here. Gosh, that's some good artwork too. Look at that. So that's you on the mountain. If you are at a high altitude, oxygen levels will be lower. Well, what will the kidney do? The kidney will make erythropoietin, which is often, by the way, abbreviated EPO. The erythropoietin will act upon the red bone marrow here in the proximal epiphysis of the femur, and the erythropoietin will stimulate the red bone marrow to do erythropoiesis, which is going to make more blood cells, red blood cells, to be precise. All right, nice little pathway. Make sure you know that pathway. Speaking of red blood cells and their levels and their production, there is a way to numerically measure it. And there's a measurement called the hematocrit. Hemato means blood, crit means measurement, and it is the percentage of whole blood occupied by red blood cells. So notice that we have centrifuged some blood, giving us plasma, giving us red blood cells, and that buffy coat. Remember that buffy coat? The white blood cells and the platelets are called the buffy coat. Let's add that. Now, once we have this centrifuged blood, what we can do is we can measure the height of the red blood cells. So I could take any sort of ruler, measure that. Let's say that this height was 50 millimeters. And then we can also measure the height of the entire blood, like all the components. And let's say that that height was 80 millimeters. To then figure out the hematocrit, I would take my red blood cell height, which in this case is 50, divide it by my blood, like everything blood height, which in this case is 80, and then I would multiply that by 100. If I did this, and I just randomly picked these numbers, by the way, and I do the math, I would get 62.5%, which is a little bit high. Normal range for dudes is like 42 to 56%. Normal range for ladies is 39 to 46. Dudes generally have more erythropoietin, which is why this number is higher. But yeah, that's how you do it. A little bit of math, not hard math. You can use a calculator if you need to. No worries on that. Okay, quick set of questions for you here. Let's suppose you followed this idiotic advice from this doctor and you started smoking cigarettes. Not a healthy habit at all. One thing cigarettes do, among the many horrible things they do, is they decrease renal blood flow. So less blood, less oxygen to the kidneys. If there's less oxygen to the kidney, what would happen to all of these things? What would happen to all of these things? See if you can work it out. Seriously, don't just wait for me to tell you the answer. Pause this video. See if you can figure this out. If the kidneys are getting less oxygen, what would happen to plasma EPO levels, and then red blood cell count, blood viscosity, percentage of blood occupied by red blood cells, hematocrit, and percentage of blood occupied by plasma? So pause this video and work this out. Pause it right now. Hey, welcome back. If you've got less blood going to the kidney, well, less oxygen to the kidney, kidneys are going to respond by making EPO. EPO, erythropoietin, stimulates erythropoiesis, so red blood cell count will go up, makes the blood viscosity increase because the blood is thicker. If you have more red blood cells, well, your percentage of blood occupied by red blood cells has got to go up, right? And number 5, hematocrit. Hematocrit is this. This is the definition of hematocrit. So it's going up as well. And lastly, we're going to buck the trend here. If your red blood cell percentage went up, well, you know, percent's got to add up to 100, right? So something else has got to go down. The plasma, in this case, is going to go down. All right, did you get all those right? If you did, let me know. And with that, we're going to move on to the death of red blood cells. Red blood cells die in the spleen. Don't forget, the red blood cell lacks a nucleus, so they can't make repairs, they can't divide and make new cells. So after about 120 days or so, they are destroyed in the spleen. There's the spleen just lateral to that stomach. If we take a microscopic view of the spleen, where the RP is, that's called red pulp because it's chock full of red blood cells, and that's where they die. Okay, there are macrophages, big eater cells in the spleen. They are constantly on the lookout for old or ugly, beat up red blood cells. Spleen macrophages eat 2 million red blood cells a second. That's a lot. Remember, you have trillions though, right? Now, once the red blood cell has been engulfed by the macrophage, the disposal and the recycling of the parts is going to begin. Now remember, a red blood cell is basically just a bag of hemoglobin, right? They're chock full of hemoglobin. And here's a macrophage with a couple red blood cells it's engulfed. And we're going to break open the red blood cells and we're going to deal with the hemoglobin. First thing we do is we separate the hemoglobin into its heme part. Remember, those were the little disc-like pigments. There were 4 of them per hemoglobin. And then the globin part, which were the 4 amino acid chains. The 4 amino acid chains are released by the macrophage back into the blood. We're going to reuse and recycle those amino acids. We'll make new proteins out of them. We'll use them for energy, whatever we need. Now, meanwhile, the heme is then broken down into its iron part. Remember the iron in the middle? And then the leftover heme is turned into a waste called bilirubin, which we did mention last video. The iron is carried by a special protein called transferrin. It's transferrin. It's carrying iron from the spleen over to the liver. The liver stores the iron as these 2 complexes, either called ferritin. Again, I like it because it's Fe. It's got that iron in it. Or hemosiderin. And the iron from ferritin and hemosiderin in the liver can then be sent back to the red bone marrow or to other locations wherever we need more iron. Now, meanwhile, bilirubin, which is this waste product, it's this yellowish pigment, it is carried from the spleen, remember that's where the macrophages were, to the liver by that most abundant plasma protein, albumin. Now, in the liver, hepatocytes, which remember hepatocytes are liver cells, they modify the bilirubin, they do some chemistry with it, they put it into the small intestine. Here's the small intestine here, as part of this digestive fluid called bile. Within the intestines, especially the large intestine, bacteria there are going to metabolize the bilirubin. Some of the byproducts of bilirubin go back into the blood and get peed away. That's actually the yellowness of pee comes from that. Other byproducts of bilirubin stay in the intestine and become part of poop. Actually, the brown color of poop, that is due to the bilirubin byproducts that's in poop. So poop is brown because we're killing millions of red blood cells every second. All right, fantastic. That is what's going on with red blood cells and their death. Now, if you look at a bruise, so here's the evolution of a bruise here. A bruise is, you get hit, right? The skin isn't broken, like there's no cut, but blood vessels under the skin have been ruptured. And so blood is going to leak into the dermal tissue. And what's going to happen, that means there's a lot of red blood cells that need to get dealt with. So what cells are going to travel to the site of the bruise to do the cleanup? To do the eating of the red blood cells. That's a hint, eating. And if you're thinking macrophages, you're right. Macrophages are going to go to the bruise site. Macrophages are going to engulf the red blood cells. Now, if I get a really good bruise, I will see it turn like yellowish, greenish and yellowish. Then that yellowishness will disappear. And the yellowishness, the greenish too, is because of the fact that we're turning that heme into bilirubin. Then the yellow disappears because the bilirubin is being taken away by albumin to the liver. So a bruise is kind of like a microcosm of red blood cell destruction. Okay. There are issues you can have getting rid of bilirubin. And when you have issues getting rid of bilirubin, or if you have too much bilirubin in general, the word for that, maybe you know this word already, is jaundice. And the white part of the eye, the sclera of the eye, can get yellowish. The skin can even get yellowish as well. Babies can often have jaundice because babies are actually doing a switch from fetal hemoglobin to adult hemoglobin. And so they are breaking down just a ton of hemoglobin, so they get a ton of bilirubin, and their little baby liver gets kind of overwhelmed. So that is one cause of jaundice, is just that switch that's happening in babies from the fetus version of hemoglobin to the adult version. There are other problems. If you have a bile duct that gets blocked by a gallstone, remember, the liver secretes bile into the small intestine, and bilirubin ends up as being part of that bile. That's another reason for jaundice. People who are chronic alcoholics can get jaundice because of the damage they do to their liver. Their hepatocytes cannot process the bilirubin the way that they normally should. Okay. So we are done with red blood cells. Let's see if we can do some white blood cells. Next. White blood cells are called leukocytes. And if you've done lab number 2, you know that the white blood cells are the neutrophils. God, that's some terrible handwriting. The lymphocytes. The monocytes. The eosinophils, my favorite one of all. Eosinophil, I can't spell today, my bad. eosinophil, and the basophil. We're going to go over all of these guys. So if you can't read my writing, that's okay. These are my 5 white blood cell, basic white blood cell types. Now, I generally have only about 4,500 to 11,000 white blood cells per microliter of blood. That is crazy small compared to the red blood cells. Red blood cells were at like 5 million. White blood cells, 5,000, 10,000, somewhere in there. Now, we do have to know our percentages. In the blood, 60% of our white blood cells are typically going to be neutrophils. Around 30% are going to be lymphocytes. Around 6% monocytes. 3-ish% eosinophils. 1-ish% basophils. And the job of all of these white blood cells is immune defense. We don't want to be deficient in white blood cells at all. All right, if you've done lab 2 already, you should pause the video and identify all the white blood cells, except for this one. Don't do that one, but do the rest. So pause that video, pause this video, in fact, not that video, this video, and identify all these guys. So hit that pause button. And welcome back. Did you identify them? What do you got? This guy up here is a monocyte. This dude is a lymphocyte. This guy is a neutrophil. This guy is a basophil. And this guy is an eosinophil. We also have red blood cells and a platelet right there as well. So we got nice collection of formed elements here. I didn't want you to do this guy because he's a little bit tricky. He's actually a youngish neutrophil, and you might have gotten confused with his nuclear shape and thought he was a monocyte, but he's not. By the way, notice white bloods have nuclei, so they're true cells. Yes. Red blood cells, not true cells, no nucleus. Platelets, not true cells, just fragments. White blood cells are the only true cells that we've got in the blood. All right, cool. Look at this monkey. Good mnemonic device. Never let monkeys eat bananas. Never let monkeys eat bananas. That's just bananas down there. Neutrophils, lymphocytes, monocytes, eosinophils, basophils. Never let monkeys eat bananas. Good mnemonic device for us right there, okay? All right, cool. Now, you noticed, and I stressed the fact that we don't have that many white blood cells in the blood. However, we do have a lot of white blood cells in the body, trillions in fact. So we find a lot of white blood cells in places where they're going to encounter pathogens. So looking in the oral cavity here, this thing right here, I actually don't really like that color that much. What color should I use? What colors do you guys like? Blue? I like blue. This is a tonsil right here. Tonsil has a lot of white blood cells. These are lymph nodes. Lymph nodes have a lot of white blood cells. This is the lining of the digestive tract. This is the intestine. All the little purple dots right here are white blood cells. We also have a lot of white blood cells in the lining of our respiratory tract. Do we eat and drink bacteria and viruses? Do we breathe them in? Certainly, certainly. So we need white blood cells in those linings. All right. Now, there is something called leukocytosis. That is an elevated white blood cell count. And that is often due to infection. Like, we want white blood cell count to go up when we're fighting off pathogens. So that's a good thing. So that's leukocytosis. Another important vocabulary word is leukopenia. This is an abnormally low white blood cell count. Penia means a deficiency. So leukopenia, or lacking white blood cells. So this is going to be bad. This is going to increase our risk of infection because white blood cells are doing that immune job, killing bacteria, killing viruses, killing infected cells. All right, earlier leukopoiesis is the production, or poiesis means production or making, of white blood cells. And we talked about erythropoiesis and hemopoiesis earlier. Leukopoiesis is part of hemopoiesis. So leukopoiesis is going to occur in what kind of bone marrow? In the red bone marrow. And of course, red bone marrow is going to be in the axial skeleton, so vertebrae, ribs, sternum, skull, plus the girdles, pectoral girdle, clavicle, scapula, pelvic girdle, hip bones, plus also the proximal epiphyses of the humeruses and the femurs. So those are all locations of leukopoiesis. Leukopoiesis is going to be starting with that same stem cell, which remember was the hemocytoblast. So all of your white blood cells are made from that same stem cell for the red blood cells as well. And that stem cell is the hemocytoblast. Okay, so one of the cool things white blood cells do is something called positive chemotaxis. Chemotaxis means movement. Taxis means movement because of a chemical. Positive chemotaxis means you're moving towards a high concentration of a chemical. And this is going to allow white blood cells to get to damaged cells, to get to pathogens, to get to other immune cells. So all of these cells release chemicals that are going to attract white blood cells. And that movement towards those chemicals is called positive chemotaxis. Now, a crucial component, like a companion job for white blood cells, is something called diapedesis. And diapedesis is the ability for a white blood cell to get out of a blood vessel, to squeeze out of a blood vessel. So white blood cells can use the bloodstream as a transport system, a highway, but then they can leave the bloodstream. And that exiting, that egress, is called diapedesis. Then white blood cells can move towards chemicals released by damaged tissue, by bacteria, by other white blood cells, and this is going to allow them to congregate, which is crucial for defense. Okay, there are two classes of white blood cells. There are the granulocytes, which are cells that have little granules. Granulocytes are your neutrophils. So I got 3 different neutrophils right here, as well as your eosinophils. I got one eosinophil here and a basophil. So those are my granulocytes. Agranulocytes lack granules, and those are my lymphocytes and my monocytes. So neutrophils, they're granulated cells, although their granules are often pale or hard to see. Neutrophils have multi-lobe nuclei, so 3, 4, or 5 chunks to their nucleus. Because of this, they're called polymorphonuclear leukocytes, or PMNs, many-shaped nucleus white blood cells. And neutrophils make up 60% of your circulating white blood cells, and their number one job is to kill bacteria. So if you had appendicitis, bacterial appendicitis, your neutrophil count would go up in your blood. Neutrophils would rush to that area to help deal with the bacteria. Okay. Eosinophils, on the other hand, they're granulated as well. They're granular too. They have these characteristic orangish granules. Bilobe nucleus. Eosinophils are going to kill parasitic worms. We see a gentleman trying to carefully remove a parasitic worm from his foot. Eosinophils are also involved in allergic reactions and asthma as well. Here are some parasitic worms in the wall of the intestine as well. They generally make up 3% or so, usually a little less, of your circulating white blood cells. Basophils, granular too. They got these beautiful dark purple granules here. Nucleus is typically bilobed as well. They're involved in inflammation. So these basophils, the granules, release inflammatory chemicals like histamine and heparin. If you had a poison ivy encounter, you would definitely get some basophil activation. And they're usually less than 1% of your circulating white blood cells. And that makes sense too, because inflammation happens when you damage tissues. You're not likely to damage your blood. You're likely to damage your skin, your intestinal lining, your respiratory lining, that sort of thing. Okay, what about those agranulocytes? Well, the first one are the lymphocytes. Typically have a nice roundish or ovoid nucleus. There are B lymphocytes. B lymphocytes make antibodies, which we know are gamma globulins. We met them. Then there are T lymphocytes. There's actually two big types. There's the helper Ts, which control your immune response, as well as the killer Ts, which kill cells that have become infected with a virus or become cancerous. Now, lymphocytes generally make up about 30% of our circulating white blood cells. Here we see a lymphocyte that is trying to kill a infected cell. So here's another infected cell. It's got viral particles inside it. A killer T lymphocyte will come up to it, interact with it, send it signals, and then basically convince it to kill itself or outright kill it. Very important cells. Monocytes. Oh no, I've got another slide here. Thought I had a monocyte slide next. If you have a lot of lymphocytes, that is called lymphocytosis. And that would definitely happen during an acute viral infection. So your lymphocyte count would go up as you try to deal with and fight off the virus and the viral infected cells. Now we got monocytes. Monocytes are agranular, big cells with these C-shaped, U-shaped, kidney-shaped nuclei. Monocytes leave the bloodstream. So monocytes are monocytes in the blood. They leave the bloodstream and then they become macrophages, the big eater cells that we mentioned in the spleen. And usually about 6% of our circulating white blood cells are monocytes. And with that, we're going to call it quits on lecture 2 here. We'll pick up with platelets and blood clotting and finishing touches next time. As always, if you made it to the end, good job. Thanks for spending 33 minutes with me. Talk to you later.